Chris Morris with Abbott, and I was curious, out of the current debate, what do you think could actually positively help the industry? Is there a provision that, or some sort of theory that you think that should be promoted outside of the innovation?
That's a very good question. I think there are a number of things that could be helpful. First of all, I think the fact that 45 to 47 million people in this country don't have coverage today means they're probably not getting the prescription medicines that they need. We're very pleased to see the President put such an emphasis on prevention. 75% of all the cost of health care in this country is driven by chronic disease. So can we prevent diabetes? Can we lower the rate of heart disease, asthma, the kinds of things that when you look at the cost, the pie, you see that these are the leading cost centers. We have a role to play there too. A lot of the medicines that we produce are intended to be used for prevention purposes. Now, another disturbing statistic that I think we've also shared with policymakers and have gotten their attention on is the very poor track record we have in this country of adherence to medicines, okay? We estimate that 50% of people who get prescriptions or get prescriptions intended to be refilled at least once eventually stop refilling those prescriptions, or they miss taking their medicine. You know what the consequences of that are. If you never fill your prescription to begin with, you're never going to benefit from the drug. But if you're taking a drug to treat depression, in many cases it's recommended you take that for 6 or 9 or 12 months. If you start feeling better after 30 days and you stop, you may have a relapse. So I think there are a lot of aspects policy-wise of what the administration has put out there that has engendered, by the way, broad bipartisan support that actually could be helpful for our industry. I believe this pathway to the biosimilars measure I talked about as well. I think that's a pretty good deal for the American public. We don't have a pathway today that would enable a second company to put a copied version of some of these biotech medicines on the market in the same way we have a generics pathway for the non-biologics medicines, right? And 70% of all prescriptions in this country are for generic medicines. Now, there wouldn't be any generics unless there were innovators to begin with. So I think the biosimilars legislation and pathway is very important. It's good for consumers, but we're saying we want to help create legislation that not only assures that these medicines, once they get there, are safe, but that they give some incentive for companies to discover new biologics to begin with, or there obviously would never be any copies, okay?